This 7-year study followed 249 women who needed a mastectomy on one side for breast cancer. The study, though, is looking at the opposite breast, the one without breast cancer. Some women in this study chose to have a preventative mastectomy, whereas others chose a symmetry operation in which the opposite breast is lifted, reduced, or augmented to match the cancer reconstruction. When patients find out that they have breast cancer, they often have a knee-jerk response to cut both breasts off. They're scared, and they think this will prevent recurrence. Patients overestimate the risk of breast cancer on the other side, and other methods of prevention, such as anti-estrogen pills, are available. The American Society of Breast Surgeons recommends that opposite mastectomy should be discouraged for patients with the average risk of breast cancer on the opposite side. Despite this, the rates of opposite preventative mastectomies have markedly increased and now represent 22% of all mastectomies in some studies. Now, there are times to consider opposite mastectomy, such as BRCA gene carriers or mantle radiation patients. In this study, the authors found that major and minor complications did not differ significantly between the opposite mastectomy and the symmetry groups. They also found that there were no significant differences in breast satisfaction, psychosocial well-being, and sexual well-being between the two groups. There were also no differences in cancer recurrence rates or survival. In other words, patients were happy with either method, and one method was not superior to the other in outcome or satisfaction. Shared decision-making between a doctor and a patient can help a woman make decisions according to her particular risk and personal desires. The data in this study will help us counsel future patients about surgical options on the opposite breast.